thank you, everybody. Thanks for joining this panel session. I'm not going to do too much of an introduction. I'm just going to get cracking with the discussion. But we are discussing levelling up and how we can utilise MedTech in the UK and particularly in the north of England to drive levelling up. And I think we've got a really great panel here today. So I'm going to very quickly task my panel to do a quick 1-minute introduction, just a quick who they are, where they come from, and what their interests are, and then we'll get cracking. So I think I'm going to go to Maureen first, if you is joining us as a PPI representative, and I'll hand over to you for a second, Maureen.
Right, thank you very much. My name is Maureen Nehler. I'm a member of the Ileostomy and Internal Pouch Association, and on the committee of the local branch of the West Yorkshire IA. I've been a patient representative since 2013 at the initial, well, it was when it was the Colorectal Therapies Initiative, so I've been here right from the beginning. In 2018, I became a member of the newly formed Surgical MIC PPI Committee, and I've been involved as a PPI representative in a number of research projects. And I was also on the advisory group for the development of the electronic prescription service. Thank you.
Thanks, Maureen. Wonderful to have you here, and really excited to hear your perspective on all of this from that background. So I'm next going to go to Phil.
An absolute delight to be with you all today. So I'm Phil Cardell. I work for the Research Council STFC, which is the Science Technology Facilities Council, which is part of UK Research and Innovation. It's one of 9 organisations which make up that organisation. Within STFC, I head up the Northwest Health Technology Cluster. So the cluster is an initiative to really support collaboration and connection between organisations. And when I mean organisations, those which exist to support both researchers and industry. So when there's opportunities we can share across regional but also national entities and use that to raise visibility of those opportunities at the national but also to the local level to industry academics, that's what we sort of have done with that cluster model. So we have several clusters in the Northwest, but also in the Oxfordshire region as well as our Harwell campus. And we are always looking for ways to connect to new organisations here where we can connect some of our core capabilities. But also as a scientist, I'm always interested in where the opportunity might be to take the learnings from other sectors and create new innovation and help to both level but also increase the amount of activity within the health sector. So yes, delighted to be here today, Ben.
Thanks, Phil. And I agree. The way of working that's obviously very close to how I like to work and close to my heart in the NHSA. So Cynthia, a quick minute from you, please.
Yes, sure. So I'm Cynthia Bullock, and I'm the Deputy Challenge Director for Healthy Aging at UK Research and Innovation. So my role is to head up and lead the innovation activity across the £98 million Healthy Aging Challenge Fund. And that supports the development and delivery of products and services that will allow people to remain active, productive, independent, and socially connected across generations. My background is in health research and innovation and commercialization, and I trained as a biochemist and a molecular biologist.
Perfect, thanks, Cynthia. And
Thanks, Ben. Good morning, everyone. My name is Paul Dimitri. I am a professor of child health and a consultant in paediatric endocrinology and also director of research and innovation at Sheffield Children's Hospital. I've also got a number of other roles as well, very relevant to our discussion today. So I'm the National Institute of Health Research, so NIHR, Clinical Research Network, National Specialty Lead for Children and Young People. And I'm also the director of one of the 11 MedTech and in vitro diagnostic cooperatives called NIHR Children and Young People MedTech Cooperative, or NIHR SIP MedTech. So as with all the NIHR mix, we are tasked with supporting the development and adoption of technology, and obviously with the NIHR Children and Young People MedTech Cooperative, that has its unique focus on children. We are the only paediatric MedTech cooperative in the country. That being said, we are led by Sheffield Children's Hospital with our core team, but we are a consortium of 7 NHS Foundation trusts and children's specialist units supporting the development of child health technology in key thematic areas led by key opinion leads. So essentially our core aim is to develop the best and most advanced healthcare for children and young people. And obviously the key focus there is technology. So looking forward to the conversation.
Thanks, Paul. And last but not least, Richard.
Thanks, Ben. Morning, everyone. So my name is Richard Stubbs. I'm Chief Executive of the Yorkshire and Humber Academic Health Science Network, or AHSN. I'm sure most people on the session know, but the AHSNs, we're one of 15 across the country. Our primary purpose to exist is to help the NHS to better spread and adopt innovation and also to support UK economic growth. Like many of the panelists, there's a number of hats that I wear that are all relevant to this conversation. I think pertinent, I think, are the fact that I'm actually a board member of the NHSA, so I should probably declare that interest. Newly confirmed board member at the NHSA, but also I'm a board member at the Sheffield City Region Local Enterprise Partnership, where I sit on the Business Recovery and Growth Board, and I'm also the India Trade lead for Sheffield City Region as well. I'm also part of the Integrated Care System Boards in Yorkshire and Humber, and I'm part of the Olympic Legacy Park in Sheffield, which hopefully will be the site of a real emerging force from this city region in terms of our contribution to the life sciences across UK PLC.
Brilliant. Thanks, Richard, and thank everybody. I think that was pretty much bang on a minute from all of you. So let's keep that rigor up. So I think I'd quite like to kick this off with a question to Maureen, actually, and I think when we talk about levelling up, I think levelling up is sort of maybe somewhere that sits somewhere between being a slogan and being a policy at the moment, and it can mean different things to different people. So, Maureen, I wondered if you could kick us off with sort of telling us about what levelling up means to you, and what do you want to see come out of levelling up, and then we'll go to the other panelists for their comments as well. Oh, I think you might be on mute, Maureen.
I was coughing earlier, so I'm muted. Yes, to me, levelling up is all about the patient having access to the same level of care and support from the NHS, no matter where they live or what their background or what care needs they require. So it's very basic. We just want to have an equal share.
Absolutely, and I think easy to say but complicated to deliver on, and I think that sounds like something that would resonate quite strongly with Richard. I wonder if you might want to come in there, Richard.
Yeah. Yes, I mean, it absolutely resonates with me, and I think my take on levelling up is, I suppose I'm very passionate that we see levelling up as an offer, not an ask of government. And what I mean by that is that I think in Whitehall, it can be seen as a demand for parity, when actually I think that is almost a begging bowl type of approach. For me, the language needs to be, how can a better empowered North that's given the same kind of investment and options that happen maybe further down south contribute to UK PLC in a wider session. So for me, it's more about the offer that we make as a system. So levelling up for me is not it's not a request to Treasury for cash. It's actually an offer to the wider UK, to UK PLC, to say this is what an empowered and repowered northern economy can do for all of us as citizens. And I think particularly when you think about the life sciences assets that we have here and think about our world in a post-COVID environment, I think there's an enormous offer that can come from the North. And I would see that as part of our levelling up approach.
Yeah, and I think, Phil, I'd be interested to hear your take on that, and also maybe if you wouldn't mind commenting on how that discussion sort of plays into your role, both with the cluster in the north, but also you have your clusters down in the south and around Oxford.
Yes, absolutely, Ben. So I completely agree with what's been said already. I think it's so important to socialize and empower the idea of leveling up. So it's not just enough that we talk about it with the decision makers or what the opportunity is, but also that everyone else understands what the opportunity is if we develop certain capabilities. But also, more importantly, is going, what are we really great at? Because there are areas around the UK which don't have the capabilities which are here in the north, which don't have that leading research base which is here. So we also need to recognize that and celebrate it. And particularly with the clusters, I think that's a great opportunity in certain domains from the research side, is to connect some of the great capabilities we have with the areas in the south, but also internationally as well, which don't have those capabilities. And for us as well, see where the opportunity is for us to really also develop those capabilities more and find out the gaps that we have. And with those gaps, work with partners who understand those areas and can really work with us to level up the entire system and approach it from one which is really drives an EDI perspective as well. You know, a diversity of thoughts and a diversity of sector input into it, but also we are trying to be, as Richard and Marina said, inclusive in our approach as well, taking all those inputs with us. So, yeah, I think some great opportunities to both celebrate what we do great, really well, and also connect it to those which can be learned from that, but also help empower us on that journey as well.
Brilliant. And I think I'm going to come to Cynthia next, actually. And I think that point that Phil made around identifying the gaps and funding the excellence obviously plays heavily into your role. So it'd be interesting to sort of touch on that as well as and when you tell us what levelling up means to you.
Yeah, no, and the same, at the risk of sounding a bit like a broken record, clearly agreeing with quite a lot of what the panel has already said, but I do speak to that point that Phil talks about in terms of a lot of what we do is trying to make sure that we are facilitating and supporting really great innovative ideas that are being generated across the country. So it isn't just about trying to support the sort of golden triangle. This is about looking at best practice across the regions and looking at how we translate that and perhaps help that to scale and spread and become sustainable, perhaps even be in a position to attract private investment where such doesn't exist. So a lot of our funding goes towards trying to de-risk propositions in such a way that they become self-sustaining and have a really clear, understandable, credible route to market. So I guess for me, leveling up is about trying to support a kind of more or a more inclusive, well-designed, affordable products to get to market to support everyone. Because it shouldn't be the case that depending on where you live determines how well you age, for me anyway, because of my specific topic area.
And I think I'm just going to go straight to Paul with that because I can see him ready to pick up that final point and others.
Yeah, it's a great final point. Thanks, Cynthia, and thanks, Ben. Okay, so leveling up. I mean, we talk about leveling up. You know, very much it's part of rhetoric now that we hear in lots of different conversations, and leveling up is really about creating equality. And so we talk about equality, or I'm going to talk about equality in from two aspects. The first is the north-south divide, and I'm coming at this very much from a perspective of children and young people. But there is a clear health inequality that requires leveling up between the north and south. There's the difference in life expectancy between some of the poorest areas in the country, which are primarily positioned in the north, and the richest areas primarily in the south. The difference is about 20 years. So, I'm sure Cynthia will come back on this in later conversation, but we talk about healthy aging, but healthy aging has been, pitched at 50 years plus. Well, actually, if you're going to die in your late 60s or early 70s, we've missed the boat. Trying to impact on health at a later stage in life is quite a challenge. And my challenge back is to say, actually, we start early to level up. We start with children and young people primarily in the poorest areas, and invest in their health to ensure that they remain healthy through their childhood into adolescence and into adulthood. And by doing that, you know, we're investing, as other panel members have said, in the experts and the best technology to drive this forward. And just moving on to that point of children and young people, you know, there is an important levelling up agenda here in terms of health spend and research spend. So, you know, I go back to what many people have heard me say before. Children are actually 25% of our population. They are, you know, 25% of our population are 18 and under, but they are 100% of our future. They are the workforce, the parents, they are the academics, the clinicians and others of the future, and they are going to be the people that will utilise the NHS and other health services across the world for years to come. So actually, if we don't invest in that 25% of the population early, we are just going to repeat history over and over again. But surprisingly, despite the size of that population, the research spend is somewhere around 5% of the total population. So there's a real mismatch there between health spend, research spend, and actually the size of our population. And, you know, it plays very much into the prevention agenda, why we need to level up to ensure healthy children. In fact, you know, maternal and child health, children that start healthy before they're even born because of a good maternal environment, a good in utero environment, and remain healthy right the way through to adulthood, so that we don't have the problems that we deal with now. And you're aware, and the majority of the panel are aware, that, you know, one of our endeavours is to support the development of a Centre for Child Health Technology in Sheffield, on the Sheffield Olympic Legacy Park, to focus on some of those big ticket items, national strategic priorities: obesity, mental health, prevention, long-term conditions, maternal and child health, just to make sure that that investment at an early stage in life creates sustainable health and healthcare for the future, but also that we change the course of health and healthcare in many years to come.
Brilliant. And I mean, some really good points there. And I think as well, Richard Brady put a comment in the chat, and I think that really aligns with what you were just saying at the end there, Paul, of just Richard's last point, that when we have an area where there's a higher burden of disease, but also that lower investment innovation, then the patients there essentially receive a double hit of inequality through the innovation and research and through the health that they already have. And I think there's quite if I don't mind, I'm going to throw that back to Cynthia as somebody who directs R&D funding in a government program, and how you think about, we talk about place-based R&D quite a lot, and how you think about that in the work that you do.
Yeah, it is tough. And I do, just before I come to that, Ben, I do agree, Paul. I know this might not be the party line, but I'm going to take it anyway. I do sometimes get frustrated in the way that we have to bid for funding and what we say we need to do with that funding. It is just the nature of the process that we have. But having said that, we go to great lengths to try to ensure that we are promoting all of our calls nationally, that we include working with partners in specific regions to try and identify potential applicants, so that we can run sort of really in-depth briefing events and Q&A sessions to help prepare them better, to ensure that those quality projects that we're guided by in terms of our funding are coming through. So we've got partners like the Knowledge Transfer Network to help sort of provide additional support. But akin to the point that you were making, Maureen, one of the things we've started doing in earnest is making sure that we've got citizens' voices throughout the whole process. So that includes the written assessment that we undertake, but also sitting on the panel and helping to shape the nature of the funding that we award. For us in healthy aging, there is an absolute prerequisite that you have to be co-producing. So you shouldn't be innovating or developing a sort of product or service, and there's an absence of the voice of the potential customer, really sort of credible involvement as opposed to tokenism. So that is quite important to us. And yeah, and where possible, we certainly our advisory groups and our program boards have a regional diversity to it, because we do want to hear those voices that Phil talked about, because the greater the diversity of voices that are helping to shape what we do, how we fund, who we fund, then hopefully we should have a greater outcome, better outcome, where we're funding things that people actually need, and more importantly for me, well-designed, really inclusive. So it's not just for the rich Southerner, so to speak, and affordable for everyone. So that's sort of some of the things that we do to try and manage that.
That's brilliant. And I think that last point of patient involvement and really getting a good fit and alignment will resonate, I think, with everybody here on the panel. But I'd quite like to go to Maureen and sort of tap into your experience of running and being a part of that for the surgical MIC and other work that you do.
Yes, I must say, when I first started off, there was quite a bit, as Cynthia says, there can be tokenism, which nowadays PPI is taken more seriously, which I think is great, because we just have so much experience. There's no point coming with a research, some research you've done, and a lot of money's been spent on it, only for the patient to turn around and say, that just won't work. The patient won't do that. You can't expect the patient to do this. That isn't to say that the research isn't good in itself, but you might have to find another way around it. But I'd also like to point out that, we talk about the north-south divide, but actually there's a lot of division even within cities, even within West Yorkshire, within Leeds. I mean, I live outside Bradford. It's considered a fairly affluent area, but 3 miles away, we've got a school where 3/4 of them are on school dinners. So, how do you, equal all that? It's very difficult to level even locally, never mind from north to south.
Yeah, absolutely. And I think, I know that's a challenge that I know Richard and the HSN have work on a lot in. How do you direct the innovation that you work with and the companies that you work with, Richard, so that benefit is delivered where it's needed, even within our regions?
Absolutely. And I think there's a correlation, isn't there, between geography and where the impact is felt most keenest. And I think it brings me on to some of the points we work at the HSM, which is not just about the import of the innovation, it's about the import of the jobs as well, and the companies themselves. I think for me, there's something about, and I'm sure Phil will want to weigh in on this, but the power of local clusters. We obviously, to bring it home, very, very home for me and Paul, I think we obviously are working very much on Sheffield City region being a cluster that has a lot to say about child health technology, as Paul's outlined, and health and wellbeing and prevention, particularly through the Advanced Wellbeing Research Centre, which is also on the Olympic Legacy Park. Now, that's a UK, if not a global offer. But I'm also absolutely clear that the proximity of the population in Sheffield City region will be an increased benefit to us in Sheffield City region. I mean, it's funny, isn't it? We're seeing it play out right now with the vaccine fight between the EU and the UK about, the fact that they're made here means that we seem to have a domination of access. So for me, it's about not just seeing that innovation has to be spread everywhere. It's the production, it's the companies, it's the clusters. Because if we're really going to start to reverse, I suppose, the trends, and particularly start to look passionately about what levelling up actually means, then it has to be as much about bringing those jobs and bringing that innovation and the research and design aspects of that closer to home, not just being at the end of a queue once they're being made and manufactured and developed somewhere else.
Absolutely. I think, Phil, I might put kind of a slightly provocative question to you, perhaps on that, but those jobs that we want to create in the regions that we want to level up, how do we ensure that we create those as new jobs rather than taking those jobs from other regions? Or perhaps maybe we should be looking to take those jobs from you know, people talk about leveling down London maybe a little bit. So I'm interested to hear your take on that.
Yeah, you've alluded onto a few of those points already. So I think it's a really interesting conversation as to how do you create new jobs, but also new reskilling opportunities across the population. I think particularly in the pandemic situation, there's been an incredible drive to reskill and also open up new opportunities. And that's sort of moving forward more and more. So particularly if you look at some of the sectors, you know, such as, or particularly in health and MedTech, digital. So coding, creating new coding academies for people to go in, learn to code and develop, and then to take those skills and apply it in companies or into projects or into government entities as well. I think recognizing that there is a need not only for the traditional education and research path, but also a need to show where people can retrain and show those examples of how they can then go into new industries. And the importance is then to also say that, well, actually, you don't need to go to London to work in a digital health company. You don't need to go to America to set up a medical technology company. Those jobs, those opportunities to both develop, retrain, skill, but also have a job or create a company, if that is your drive as an entrepreneur, those opportunities are here. So we need to continually improve how we make that information and those routes more accessible, more well-known, and keep having the conversation. Not just have the conversation, you know, just once or twice, but keep having that availability for people to say, going, hi, I would love to retrain as a coder. I would love to get involved in research, or I would like to support the co-design process in MedTech, which is already talked to, is so important. How can I do that? So I think the more we can socialize that information with other organizations who are working in this space, with government at local, national levels, with universities who are creating that talent, and with those companies as well, involving everyone as much as we can in the process, then we start seeing the power of those local communities, those clusters, those opportunities really going out to the whole system.
Really good points. And I think I'd like to take a thread of that and sort of circle back around to almost where we started a little bit with Maureen's comment of involving patients in co-design and involving them. So sort of an open question for the panel around what do you see sort of the role of support groups and patient support groups and charities in perhaps assisting that work to connect patients and people to the development process? So Paul's got his hand up.
There's not the facility on, but you have to do it. Actually, literally put your hand up to do it. Great. I mean, look, there's some really fantastic conversation going on here, and I wanted just to tap into some of what Maud and, you know, again to some of Richard and Phil's comments. So the co-production side, I absolutely agree. We have moved away from tokenism. It's a thing of the past. And, you know, one of the things we were very clear about when we started a child health technology network many years ago, which then morphed into becoming the NICHR Children and Young People's MedTech Cooperative, this was the TICH network, Technology Innovation Transforming Child Health. And, you know, Richard and his team were extremely helpful in supporting the development of that network. They funded the start of it, and it's a national network now. But the principle that we work on is health technology designed for children with children. And that is fundamental, because actually if you don't get patient involvement early on in the process, there is that horrible term, the technology valley of death. But how many times have we seen technology developed only to fall at the last hurdle because, you know, the patients and for us, the young people that we look after say, yeah, it might work, but it's rubbish. It doesn't work for us, you know. And you know, the days are gone for developing pediatric technology where you slap a nice sticker on the side and say it's now pediatric, or you repurpose something. You know, there is a real focus of getting it right for the patients we look after, whatever age that we look after. So, you know, in every stage of the innovation pipeline where we can, we involve children and young people because they are fundamental and in fact essential for that technology development. And to raise another point that Maureen raised about this issue of digital inclusion and exclusion. You know, we can't assume that everybody has access to the technology that we deliver on. And I think the perfect example at the moment is the issue with schools. You know, it's fine if you're a family that owns, a laptop, a couple of tablets, etc. What if you've got 5 children, 1 tablet? How do you then cope with education? So when we think about the development of technology, again, at whatever age, I know I'm coming at this from an angle of children and young people, but we need to think about digital inclusion and exclusion. How do we reach the hardest to reach populations where actually those healthy inequalities exist? And just going back to Richard and Phil's point about this local focus and a local offer being a global offer. And I think that's a hugely important point, because there is often within the levelling up agenda this thing about we take away from the South to give to the North. And actually, I don't think it's really about taking away. I think what it's about doing is developing those globally renowned innovation clusters. Hopefully we'll have many of those, and we do already have many of those in the North, but actually there is a local and regionalised focus, but it's to give back to, the UK and hopefully internationally as well. So, what you do is you create a local offer, but on a global scale that you then scale up, to the UK, to Europe. The children in the North are no different to the children in the South. They still need the best healthcare and the most advanced healthcare. And, you look at the UK as a whole for child health, you go back to the Turning the Tide document from 2017 from the Royal College of Paediatrics and Child Health. We met none of the 14 health indicators in Europe for child health, yet we purport to have the best the best healthcare system in the world. So there is a disparity there, is a levelling up issue there. And we've got the highest birth rate in Europe, and we've got the highest population of children in Europe. So, there, again, I come back to that focus on children and young people, but a scalable local offering where we have internationally renowned local and regional clusters that can benefit the whole country. And we should place, a good proportion of those where industry is in the North.
Thanks, Bill. I can see Richard and Phil nodding vigorously there, and I don't know if either of you want to add anything to that. We've got about 10 minutes left on the panel before I need to sum up.
Can I say something on?
Absolutely, Cynthia. Please.
Sorry,
do.
I just perhaps this is just me being a bit of a devil's advocate, so I'm going to go for it anyway. So I think there's a balance to be struck. So a lot of what I spend my time doing is trying to figure out some of the clusters, where those clusters exist, where those pockets of expertise are, them in order to get them to that global stage. But actually, we can't. I mean, just for example, within healthy aging, I know where the pockets are. That's just healthy aging. And having a finite pot of money, there's always a balance between trying to get everywhere across the whole country to become a center of excellence with respect to healthy aging, or actually just funding the peaks, as it were, funding those specific areas that I know are already doing some really great stuff in that area and have the local infrastructure to support those innovative businesses once they come through. So I think with everything, there's a level of balance. And one of the things we have to get better at doing is being able to adopt best practice from elsewhere. So if we're all wanting to develop products to get to the global stage, somebody is going to have to be adopting those products and services that aren't developed in their area. So I think there's something about a balance with being able to do that.
Absolutely. And I will agree in a moment, Richard, but I just want to add, I think I would argue I'm from a biased position, but I think Richard will agree with me. I'm not don't want to put words in his mouth, but that's where cluster development organisations that have that view, like the NHSA, like the HSN network, like what Phil works with, Health Tech North and the STFC clusters, to bring those peaks together and look and understand the wider aspects in the local economies, because you need that. You need that research excellence, but if you want to develop it into an economic growth for a region, you need other factors sprinkled in there as well. And I'm going to not talk so that Richard can get into them. I think he'll be able to. yeah, so that's my shameless plug that I think we need to be, UK government needs to be funding cluster organisations a bit more to help provide that insight and that added value there. But I'll stop evangelicizing and go to Richard.
Yeah, thanks, Ben. And obviously, I wouldn't disagree with that. And I'm not disagreeing with Cynthia either. But yes, everywhere needs to import better. And the North needs to import better from the South, and the South needs to import better from the North. But I don't see levelling up as simply an improvement in our import expertise. We are creators here as well. Now, I think, so for instance, there are more life science companies in Yorkshire than in Oxford and Cambridge combined, for example. Now, we don't have the capital investment and the funding, but in terms of the gross numbers, we are ahead. And so there's a huge opportunity to build. What I notice, particularly when there's a energy or activity around the industrial strategy or its various sequels, there's a shorthand in Whitehall to places that they know. And I think we are as guilty as to why that happens as Whitehall is. So one of the reasons we need to do better if we're going to truly level up is we need to be better ambassadors for our regions and our adjacent regions as well. I think we fall into the trap of, in my part of the world, it's Sheffield versus Leeds. If Sheffield and Leeds are in agreement, it's probably because they only joined together to disagree with Manchester. Newcastle and Liverpool are somewhere in there too. There's a conversation we need to have, and it is about clustering, but it's also about recognizing the mutual compatibility of the respective offers that each of our sub-regions has. I look at Leeds and its power around digital health in particular, but MedTech as well. I look at Sheffield, clearly child health technology, as Paul's eloquently outlined, but also prevention and wellbeing as well. Huge complementary offers there. What we fail with is a brand, and we fail with being on the speed dial of government. So I think a lot of this is we need to tell our story better. We need a better narrative. I don't think we'll ever stop government and civil servants from being reactive to a speed dial of, I need to phone the cluster that I know about right now because there's an opportunity. The trick is, how do you get onto that speed dial? So I think that's, for me, is the bit that we need to focus on, and we can make some significant changes to that because we're quite poor at it at the moment.
I think that's some fantastic points. So see, Phil's got his hand up. We've got 3 minutes left, Phil. So and I need to do a sum up. So if you can do it in a minute, 2 minutes, go for it.
Got it. No, firstly, fully agree with Richard. I think the more we can raise that visibility, celebrate the clusters we have, the excellence we have, and where they are, and make that known again, between us all, but also in the South and also internationally, the more we can do that, better. Because that improve the collaborations we have, as well as the visibility for investment and investment opportunities, both private and public. And that's a huge thing. Because, when we do look at those opportunities in sort of the more London, Oxfordshire, Cambridge regions, there's also co-location of investment as well. And the more we can show and work with organizations that there are opportunities here, the better. As the thing I've mentioned already, the opportunity, particularly in MedTech, to learn and harness the expertise from other sectors as well, like digital, energy, space, etc., to really work with what we have in a region, and also, nationally as well. That's another opportunity that we can really level, but also scale up. So I think you've got that balance between, as Cynthia was saying, scaling what we know and scaling what we would like to have at a higher international stage, but also growing and nurturing the capabilities, the talent, and the research which can feed the future pipeline as well. And it's both approaches, not one or the other. But to do that, let's continue to improve that harmony, that song sheet, that narrative we have, to make that more known. And we do need to talk about it more, about the great opportunities and the great capabilities we have in the regions in the North here.
Brilliant. Thanks, Phil. And in exactly the time I allotted you. So I don't think that I can really do a better summing up actually than you guys have provided in those last few just round of discussion. So I just really want to say thank you to all of you for joining us today, all of our speakers, all of the audience, and I now need to so the expo will go live, so you can go and have a look at some of the medtech companies that participated in the challenge that the Surgical MIC ran, as well as some others that have joined from throughout the North and wider, I believe. And we also are going to go back to the main stage. I think we'll go live in a moment. So look forward to continuous conversation with all of our panelists and anyone else that wants to get in touch afterwards. And once again, thank you to all of you. I think it's been brilliant.